LTC Heroes Live by Experience Care. My name is Peter Murphy-Lewis. I'm your host. I'm at HIMMSS Day 2. I've been all over the floor. I've been mainly in the innovation room. But today I'm talking to Christiana Voelker of Avanade. She's the Director of Healthcare and Industry Lead. Christiana, welcome to the program.
Thank you. It's great to be here.
Christiana, I told you before I went live that I was a little bit nervous. You'd have to speak down to me in layman's terms. I am a CNA, a Certified Nurse's Aide, so you're going to have to explain to me what you're doing at Tech and Avanade that will impact us in long-term care, post-acute care. So with that, I'm going to give you an open question, and you tell me what you're focused on right now. Okay.
So we at Avanade are focused on just transforming care experience, leveraging technology. In the long-term care and sort of home care space, we are primarily leveraging Microsoft software solutions and sort of configuring them and tailoring them to healthcare use cases. And the way that affects you is that instead of documenting things on paper, you can document things digitally. You can also have command centers in the background that are organizing all of the care and monitoring all of the care. And they would have dashboards and alerts and all kinds of things, and basically connecting to patients in digital forms, whether it's through apps and chatbots or remote devices and monitoring their vitals, or communicating and collaborating with the nurses in the field, or working remotely. So,
thank you for the introduction, and thank you for speaking on my terms as a boy from Kansas.
Sure.
Christiana, tell me, I'm interested in how we got to where we are. Mm-hmm. So speak to either the development where we were 5 or 10 years ago. How do you get the feedback, specifically in long-term care area, to continue to finance and improve the product? Explain to me what that process looks like on your team.
Yeah, so going back in time a bit, actually when I started my career in healthcare technology, it was the days of EMR deployment initially, and then actually I worked with the tool Proving Meaningful Use, and so that was really the start of transforming care and digitizing everything. And so once we started digitizing encounters in the hospital and in the doctor's office, that really opened doors to digitize care everywhere. And I think even before COVID, but certainly COVID accelerated it, we have been moving care out of the hospital and out of facilities and sort of, less traditional forms of care. So, but there's still the desire and the need to digitize those. And so we have worked with a number of different customers that are interested in transforming and digitizing their care anywhere, essentially. And it's on a number of different fronts, whether it's patient engagement and just being able to communicate with patients, or whether it's actually monitoring them with remote devices and putting them on care plans and trying to keep them out of a hospital, or if it's actually deploying clinicians to another location, whether it's their home or somewhere else. But it's really been an evolution of just using technology more and more across the board. And certainly, there's been a lot of changes in technology, so now we're hearing about metaverse and AI and all these things, and now we're working on leveraging those, and our customers want to know, how do we use these technologies? And so that's where Avanade comes in to really help our customers know what the technology is and how they can use it. And how they can improve their patient outcomes and their clinicians' experiences.
I was going to specifically ask you, in your role on your team, are you involved with the development of AI?
A little bit. I actually, my most recent project has been developing one of our solutions around patient access and scheduling. And we've actually just been talking to Microsoft about how we can leverage AI more in that solution. But I've also helped support some of our intelligent chatbot development, where it's training AI on how to interact with certain criteria. So basically training it on certain published research, and then using that as sort of an education chatbot with patients. Particularly, we were doing that around COVID treatment and things like that. But it's very different than a traditional chatbot, because a traditional chatbot, we have to train on every interaction, and it hits walls all the time. Like, I don't get what I'm supposed to respond to, if the person is putting in a non-traditional comment. And so the intelligent chatbots using AI, you basically train them on certain models and information that you want them to know, and then they generate the response, and that's why you call it generative AI. And it uses these large language models, and it's very slick.
I've got a weird question. I've definitely never asked on the podcast, and I'm guessing no one, at least at Long-Term Care, has asked you. When you're in the tech space, like we are at HIMMSS today, how do you line up the KPIs that we have in post-acute care with the product you're developing, when it's nowhere close being in relation to a human being yet? So let's say hospitalizations, and you're working on a chatbot, or you're talking on some type of monitoring. At what point in your development of that product do you start to line up a KPI with a leader in a long-term care facility with the product that you're leading it? It's a weird question, so hopefully you can decipher what I was trying to ask.
Yeah, I think I get what you're trying to ask. So that actually usually happens really early, because we don't just generate solutions to generate technology. We generate solutions to respond to our customers' needs and challenges. So we are usually co-innovating with our clients. So if they have a particular challenge and they're trying to address it, and let's say they're trying to reduce hospitalizations through leveraging a chatbot. Actually, I just heard a great seminar on that topic, essentially, and how they were using a portal and a chatbot and integrating patient education and diagrams and videos and pictures into that to educate. In this case, it was just for pediatric hospital, and being able to educate parents, like leading up to a surgery, and making sure that they, their child didn't eat and they didn't do certain things, and they knew how to get to the surgical, center or the hospital to get their care. Or they were also using it to reduce no-show for telehealth, so sort of prepping them on proactively reaching out to the patient and engaging on a chatbot to make sure that they had, their Wi-Fi set up, and they knew how to get into a virtual visit, and they knew where to go if they had questions or technical issues. So really early on, we do a lot of the collaboration with our customers.
Thanks for that. Thanks for deciphering my question, answering it more appropriately than the way I asked it. I think kind of my last question I just want to wrap up is on the personal level. I talk to a lot of tech leaders like yourself, and I like to ask the question, at what point does their work line up with like personal satisfaction? Can you give some examples of where you know that you worked on something for 2 years, and then you hear feedback from either a sales rep or from a board member saying, hey, this is what we just did and this is how it's changing lives? Can you give me an example? Because a lot of times you guys in the background, and you don't get the credit for the work that we're getting that's improving people's life.
Yeah, so I have, in the past, I've worked with one customer particularly to avoid readmissions and work on remote patient monitoring and remote care planning and engagement. And that customer explained that they had a huge reduction in their readmissions, and they were able to manage patients with chronic diseases so much more effectively. And so that's sort of heartwarming for me. And I just have a personal interest in healthcare because I grew up in a family of providers and thought I was going to be a provider. And actually, right when I was sort of going that route, I was diagnosed with a chronic condition and have had to navigate the healthcare system on my own, figuring that out. And so I understand firsthand the challenges of managing a chronic condition, and also as a mother and a child, I have elderly parents that need some assistance sometimes, and I have young children that need care. And so personally, I want to transform patient experience because I deal with it all the time.
It makes sense. I'm glad to hear that it resonates. You hear what's happening on the front line, and you take it home at your office, but then it ends up hitting home with your family. Thank you for sharing your time, Christiana. It was great to hear it. Thanks for making sense to a CNA, and great to meet you here.
Yeah, great to meet you too. Thanks for inviting me.